More positive signs from the state of New York. Not great. Still people are dying. We want everyone to live. But as hospitalization rates, they are now at its lowest point since the beginning of this crisis. In the state of New Jersey, the number of patients on ventilators is decreasing. In Oklahoma, a hospital is closing due to a lack of patients. In Louisiana, we'll have an update from Senator Kennedy in a minute. Numbers from Wednesday show fewer state hospitalizations, fewer patients on ventilators, and fewer new cases reported. Now, deaths remain high in several hotspots, but remember, experts have been saying the death rate is the lagging indicator of the disease. You hope for the plateau, then the precipitous drop if the patterns hold. Now, if these trends continue, it appears that COVID-19 is now leveling off in the United States. The next step is what we are hoping for, a dramatic drop. We can't take our eye off the ball. This country must now plan for a new massive challenge simultaneously. How do we safely get this economy up and running as quickly as possible? Wall Street Journal pointing out, based on the latest analysis from America's leading public health experts, politicians can stop comparing COVID-19 to World War II, but can their war on the U.S. economy be halted in time to prevent irreparable damage? This country cannot print money indefinitely. That's just a fact, too. At some point in the near future, safely, businesses must reopen. Americans must return to work. And to their credit, the American people want to get back to work. That's what they do best. But if we don't figure out how to do this quickly and safely, the country will see long-term economic suffering on a massive scale. We've got to prepare to transition to safely getting back in the workplace. Already, just this week, we got more massive jobless numbers. Keep in mind, and this is important, whether or not this virus rebounds is not a question of if. The doctors, the experts, they're telling us it will reemerge, it will rebound. We can prepare ourselves for this. So the question is, how do we get Americans back to work safely? The answer is not simple in every case. The solution will likely be tailored to different communities all across the country. In many places with a high population density, like New York City, masks, gloves, elbow bumps, compulsive hand washing will probably be the new normal for the foreseeable future if we want to keep the country running. For areas with less population density, this transition, it could be much easier. The real key to doing this safely and successfully is going to be testing. Now, we'll be asking Dr. Oz tonight, how do we open up America and prevent that rebound? Incredible innovation by Abbott Labs, and this is incredible testing. These guys deserve a lot of credit for this. This has now led to a test we now know can determine positive cases of COVID-19 in as little as 5 minutes, negative cases around 13 minutes. The test is conducted on a lightweight platform, as you can see there, about the size of your toaster. And to date, Abbott has the capacity to determine 50,000 results each day. Soon they will be up to 2 million. Now, if businesses in New York and elsewhere, if we are capable of implementing, using this Abbott test, widespread testing, that capacity, we do need to increase it dramatically. That's going to be, I think, the tipping point in all of this. In the meantime, other measures could involve digital temperature checks and continued telecommuting and teleworking for those who are able. In other words, essential personnel go in, non-essential, they can work from home and do a great job. It's working on my team, my staff here at Fox. Widespread antibody testing could also be a very critical tool in getting Americans back to work. And as we move forward with this strategy, it is critical that patient privacy, constitutional rights, civil liberties, they must be protected. This is the United States of America. We have a constitution. For example, there cannot be, and I've read people are afraid of any type of government record or government database. Now, there is no such need for such a privacy invasion, none whatsoever. Medical privacy should be in the forefront. Patient privacy protected. Civil liberties must remain intact. We can do both. Now, still a major question remains, even with these strategies. Okay, how do we get people into restaurants again safely? How do they reopen their dining room doors? How about movie theaters? What about sporting events and concerts and venues? What about the airline industry? These are not simple questions here. How do we get every sector of the economy back up and running without jeopardizing the safety of the American people and subsequently some type of rebound.